Hi, everyone. Thank you for making time for this session today, which is extremely important and very close to my heart. Because over the last couple of years, the whole perspective on breastfeeding has completely changed. And can't blame young parents out there because there's so much of misinformation in the market and so many fears about breastfeeding. At the same time, so much of powerful science and wisdom on why a mother should breastfeed. And of course, some moms can't breastfeed. They genuinely have problems, and it's not to make people feel bad that they can't do it. There's always an alternative. But most of the little, problems that young mothers face can always be handled easily and at the right time, and you can even prepare to have a beautiful journey of breastfeeding with your child. Some of the most common questions I get from women, and when they deciding to get pregnant or it's time for them to deliver and breastfeed, Luke, will I put on weight? Luke, will my breast sag? Luke, will my body change? Luke, will I put on more body fat in my abdominal area because of a hormonal change? Will it be painful? At the same time, there are fearful questions that, Luke, my doctor said 6 months is enough. But I've read articles where the longer I breastfeed, the better it is for the baby and for me. We've had doctors and sessions which we've done where people are now establishing the connection of mothers who feed longer. The immune system of the child is better, including the mother, and even risks of cancer are lesser in mothers who feed. These are all science. These are all the new sciences that are coming. But again, what happens to a mother who can't feed for 6 months? Does this mean she'll get cancer? Absolutely not. Does this mean that the child will have a low immune system? Absolutely not. So the idea is to find a midway and to do our best and prepare ourselves, because at the end of the day, we should never forget it's a natural thing. It's absolutely natural. And we shouldn't be the first to jump onto formula feed because it's convenient and it's easy. And I encourage mothers to think about the whole process, that if you're having a child, okay, try to do it the right way. It's good for you and it's good for the child at the same time. So Dr. Manisha, thank you so much. I know how busy you are. You've been working with our patients and our pregnancy patients across the world over the last couple of years, helping mothers through this, helping mothers, teaching them how to deal with the problems that they face during breastfeeding. So thank you so much. Dr. Manisha is a doctor and she is also a lactation expert, handling international clients around the world. Welcome aboard and thank you for your time. Dr. Manisha, I'll get straight into it, okay? What is the importance? Why should mothers breastfeed? What is in it in the quickest possible way for the mother and for the child?
Great. So, see, as you rightly said, breastfeeding is the most natural, the most physiological way of feeding a baby. It is as if a baby who is born expects to be breastfed, because that is something that all mammalian species do. And the breast milk that the mother produces is exactly tailor-made for her baby's needs. For example, a mother who gives birth prematurely to a preterm baby, her milk is different from the milk of a mother who gives birth full term, So this is the wonder of nature, that the milk has evolved over centuries to exactly meet the needs of that particular baby. And it has the perfect combination of all nutrients that a baby requires for the first 6 months. So you name it, carbohydrates, fats, proteins, all the vitamins. In fact, you talk a lot about gut health. So there are so many probiotics in the breast milk. There are stem cells, and newer research tells us, every year we are learning something new about breast milk, which is so fascinating to me because I study it. The immune system of the baby becomes stronger because initially when it's immature, the baby is receiving live cells, antibodies, immune factors, everything that the mother has, the baby is getting in the form of like a vaccine, So especially in COVID times, it has become very important because research already is underway, and they have found that mother who has suffered from COVID, there are antibodies to protect the baby in her breast milk. And even vaccinated mothers have antibodies which are passed on to their babies. So we got so many inquiries currently about mothers who had to unfortunately stop breastfeeding because of certain problems, issues, they didn't get the right help. and there was a lot of stress around COVID, deaths in the family, all of that. These mothers are coming back to us for relactation because they now want to start breastfeeding again. And you also talked about diseases. So infectious diseases like respiratory diseases, gastric diseases, allergies, eczema, asthma, cancers, childhood cancers. So, I mean, the list is endless, the benefits that the baby gets from breastfeeding. Even the mother is benefited. The longer she breastfeeds, the lesser are her chances of getting cancer. And some interesting facts, like when she reaches these mothers who breastfeed, when they reach menopause, the chances of osteoporosis in mothers who have breastfed are less than the mothers who have not, or they don't suffer from osteoporosis so much. And there is research on that. The baby having metabolic diseases later in life, like obesity, diabetes, heart disease, all these are also prevented. So the longer the duration of breastfeeding, the lesser the chances of all these diseases and ailments.
Right, Dr. Manisha, then why is it that women want to finish off the process as quickly as possible? I understand there are genuine reasons. Maternity leave's ending, they need to get back to work. But what I see in the West is that people today are feeding for like 1 to 2 years and they're managing their jobs. They feed their babies, they do everything else. So is it more of a social kind of a thing that is, pushing women away from long breastfeeding? Is society looking down on, I know a lot of women who say my friends make fun of me because I'm still breastfeeding my child even after 1.5 years. What is it that you notice in your line of work, and what is your message to women out there to ignore all of this and to do what is right for the mother and for the child?
Correct. So see, that motivation within the family is very important. So what I just spoke about, knowing the right reasons why I want to breastfeed my baby as per the recommendations. The World Health Organization recommends breastfeeding up to 2 years or beyond. But unfortunately, even in the medical community, we find some doctors telling moms that after 1 year, it makes no difference whether you breastfeed or not. And that's so not true, because what we have found is a 1-year-old child is always up and about, touching his hands everywhere, exposing himself to a lot of germs. And the milk of such mothers who are breastfeeding after 1 year, the level of antibodies and immune factors is much higher. It is because the baby needs it, right? So these myths that are present around prolonged breastfeeding, as if it has no meaning because the child has already started eating, so not true. I mean, science has disproved them, and we need to spread this message across how important it is, long-term breastfeeding.
Right. I'm in agreement with you on that, because children will naturally crawl and they're naturally going to pick up dust and germs on their fingers. And the whole idea is the gut microbiome needs that. But they're also protected from the dangerous part of it because of the factors in the milk. So it's such a beautiful process. If a mother can feed, I think it's a great thing. That's a personal decision for everyone. How can young moms prepare themselves for like healthy breastfeeding? Because a lot of them have cracked nipples, a lot of them have that pain when the baby latches on, and they've just gone through the whole process of giving birth, and now the fear of not being able to feed along with the pain. What advice would you give to women on this, doctor?
Yeah, so the best time to learn more about breastfeeding is while you're pregnant. I strongly believe that, because what we found is women who have undergone this antenatal education, be it in the form of classes, be it, talking to experienced moms who have breastfed, or reading about it, watching scientifically correct videos on it, So the way they prepare for birth, having a natural and pain-free birth and all of that, I think they should devote some time to preparing for breastfeeding also. You might say, all this is currently available, breastfeeding classes. Where were such classes before? But the society was different. People were living in joint families. So most new moms, most women who became pregnant had already seen a couple of women around them, be it relatives, sisters, bhabis, chachis, So they had seen people around them breastfeed, and it was so normal to just, like, once you have your baby, how do I hold? Today I find women finding it really awkward to even hold their newborn. Say, no, doctor, you hold the baby, you bring the baby to my breast, because they find it so awkward. They've not seen it around. So I feel we need more mother support groups. So we have these mother to mother support groups which meet, say, once a month, where we have pregnant women as well as breastfeeding mothers. They interact with each other. They talk about the problems that you were just discussing, that it's normal to have problems, but the point is you need to overcome them. And yes, understanding the whole process, how to hold the baby, how to latch the baby, how do I know if the attachment is correct or wrong? How do I know whether my baby is getting milk? So if you have some basic knowledge on this while you're pregnant, you enter into breastfeeding with some level of confidence. And of course, having all your resources ready. So I would say the first resource is the family, just bring the family completely on board with your breastfeeding journey and your goals. Like, this is what I'm going to do, and I'm going to need a lot of hands-on help, because a breastfeeding mother needs time. She needs healthy cooked meals. So this is where the Indian culture is so good, that we always have people around us when women are giving birth, and the family usually, if it is there, they are supportive. Of course, COVID has changed this picture a lot. I've seen a lot of families in isolation, and counseling them. It has been really tough for me also to see they don't have any help. But trying and arranging for that help, and trying and getting the knowledge, I feel these are the most important things in preparation. Now, mothers, when we talk of preparation, they usually feel, what is it that I need to buy? What is it that I need to get? Frankly, nothing, it's just you and the baby, and that bond between the two of you, and knowing the right things to do. That's all that is required, frankly.
Yeah. So I've seen, Dr. Manisha, I've seen it in villages, because I grew up in a village. And, you could see people around, I've seen a woman deliver a baby, and like 6 months later, she's working in the field. Her baby's in a little hammock swinging on the branch. She takes a break, she feeds the baby, she eats something, gets back to work. It's like effortless, They don't have any fancy equipment. I guess times have changed, but why I'm saying this is because it's a possibility that it's simple. It can be a simple process. And I think there's too much of complication around breastfeeding and all of these things. And like you rightly said, I think education plays a huge role. Now, I had another question for you, Dr. Manisha. I know this exists in the US because when I used to work with cancer hospitals, especially the child ward, and if, the child was an orphan, born, the mother died at the time of birth, milk was still required, but they had milk banks, or they had breast feeding volunteers where your child could still feed on a mother's breast, because it was that important for mother's milk. Do we have these kind of networks in India, not only for the misfortune of a mother dying, but also if a mother really can't lactate and she has a genuine problem? Like, I have many patients who have breast cancer the moment they're born and they can't feed. So the whole point is, do we have these networks in our country, out of curiosity?
Yes. So, wet nursing was a tradition in India and across many other cultures. So when we say wet nursing, like, the traditional term for it is the daima, so it is like someone else. So people used to feed each other's babies, relatives, friends, and it was supposed to be very common. Now, with the arrival of diseases like HIV, hepatitis on the scene, these practices were gradually discouraged, right? So when you talk of a milk bank, yes, if we are trying to obtain a milk from a milk bank, we know that that milk is pasteurized. The woman who has donated the milk, she was tested for all these diseases, so that has become a more reliable way of obtaining donor human milk, as we call it today. Right. So in India, we have the human milk banking network, and gradually the number of milk banks in India are increasing. So which is a wonderful thing, really. And so many sick babies, I would say this donor milk is actually saving lives of so many babies. But unfortunately, these milk banks are in these huge, big government and municipal hospitals, where the demand is always so much more than the supply. because there are these so many sick babies being admitted. The NICUs are completely full and all the milk is consumed there. So if, in my private practice, if a mother asks me, I want donor human milk, I find it very difficult to get it for her. But
Okay.
yes, private hospitals are coming up with this idea. And I would, it is my dream that at least, every private hospital which has a sizable NICU and number of deliveries must have a milk bank. That it is something that is the need of the day. Because anytime, if you see the hierarchy, what we call the hierarchy of feeding, the first best thing for the baby is the mother's own milk. Right? Yeah. Either she feeds directly or she expresses it out. And the next best thing is the donor human milk. And the last comes the formula, if even donor human milk is not available. So this is the hierarchy by the World Health Organization, not by me. But the point is that much importance is given to donor human milk, And I'm hopeful that we will have more and more such milk banks come up in the future.
So, doctor, very question again, before we get back into the technical point. So if women want to actually donate milk, how does the process work? Can you connect us with a network where we can have people go, and what do they need to do? I'm sure a blood test to check if they're free of disease, and then they can just go and donate milk.
Absolutely. And we, in fact, in COVID, we had many such donations come up. Women were unable to reach the milk bank because of traveling and such issues. So there were donations for these mobile vans, which would actually go and pick up the milk and get it to the milk bank for processing. So yes, this is very much possible. I could connect, I as a person and we as an organization could connect you to the human milk banking network. And we would really love if, for women who have excess milk to donate this milk for such sick babies.
Absolutely, Dr. Manisha. We would like to work with you on that to make it available to people. So my next question is, I have a lot of women who they lactate and then they go through extreme periods of stress and all of a sudden they can't. So I'm 100% sure that stress levels, chronic stress levels impact lactation. I've seen it with all of our patients. And I asked them, last week, was it good? They said, last week was fine. This week I can't. And I said, what happened? They said, oh yeah, weekend I was really stressed out. This problem happened, that problem happened. So there is a definite connection between stress and the ability to lactate. So what are some of the tips that you can give women? Everyone has their own stress. So, how do you handle these kind of cases, doctor?
Yes. Again, I would stress on the family support. What I have seen is where the woman has a lot of support around her, she is able to deal with the stress better. So I won't say stress doesn't happen or doesn't occur, because that's not true for me. That's not true for you. It happens for everyone. Yeah. But the more support you have, the more understanding people around you, they kind of, she should have somewhere to vent out her feelings, what she's going through, and someone to empathize with them. And I have had many patients now who have lost near and dear ones to COVID. And these were new moms, breastfeeding, completely stopped lactating. Completely means it was shocking to me that they said, I'm not even producing a drop. That was the high level of stress. To kind of bring them down from it, say it is okay. It is okay to feel what you're feeling. Somebody to just tell them that. And then get on with dealing with the actual issue because most of the time, whenever if the baby is crying, it's the mother who is blamed always. You are not producing enough milk. The baby is hungry. I see that very often. Let's give formula. So there's so much pressure around her related to the issue of breastfeeding. Also, the point that you mentioned earlier about, breastfeeding in public or breastfeeding an older child. All these are issues. The mother, I feel inherently, she knows that this is right for her and her baby. She has that intuitive feeling, but because of the people around her, she kind of succumbs to, that pressure that is there. So as not to succumb to that pressure, she needs to build up her own resources, such as how, all the things that you promote. Good sleep, maybe meditation, yoga, going out into the fresh air with your baby. You carry your baby with you because, yeah, it's very difficult sometimes to leave the baby and do things for yourself. But there's so many things that you can do with your baby. It shouldn't be all about feeding, because sometimes you get obsessed with caring for the baby and micromanaging things. You should see the kind of logs they send me. Like at this 9:02 a.m., I fed 15 ml of milk. I said, I don't want the numbers. I'm not interested. So don't be so overly obsessed with numbers. Just enjoy the time with your baby. That's important. So getting them to that place is, I feel, that's a job of not only the doctors and the counselors, but the family as well. So when I have a counseling session, I make sure that the family is also attending it. So they also listen to all this. It's not like the woman is just getting all the knowledge on breastfeeding and others around her are clueless. So just involving everyone.
I know, and I know formula has its place, very genuine place, when there's absolutely no breast milk and no matter what you do. But I think people in the audience has to know that man-made formula can never, ever replicate the constitution of breast milk. Not even close to it. Absolutely not even close to it. And of course, I mean, I'm not against formula. I mean, at some point, my child went through formula for about a month because, she had to. So it was there. It was available. But the whole point is, if people think that formula is a replacement for breast milk, you're absolutely wrong, because breast milk has what man cannot make in factories and industries or whatever it is. So I think if a mother is able to feed, it's the most beautiful thing. And also to bring about the oxytocin and the mother-child bond. And that's something that I think a lot of mothers need to understand. We've been studying oxytocin in depth because, we try to use natural oxytocin as a pain reliever in our cancer patients. Yes. And, bonding, and even in, couples coming back together, children bonding with one another. So I think oxytocin, as we know, is called the cuddle hormone, the love hormone. It's, it happens also when a baby suckles on a mom. That bond creates oxytocin and creates a natural bond between the mother and the child. And I think that's a beautiful thing. Doctor, what's your take on this in case a woman can't really feed? Because then they all say, hey, Luke, you spoke about oxytocin. My baby can't even latch on. Does this mean that the bond is not going to happen? So can you talk about that, please?
See, the beauty of oxytocin, as you rightly called it, the love hormone, you don't need to actually even lactate or breastfeed your baby to release that oxytocin. That first surge of oxytocin occurs the moment the baby is born and put on the mother's bare chest, skin to skin. And they found the level just surges up. And every time she holds her baby skin to skin, the oxytocin goes up. So in, my adoptive moms who are adopting babies and they are coming for induced lactation, this is the first step, increasing the level of oxytocin by telling them to go skin to skin. The same thing with all the premature babies. We tell them kangaroo care. So the kangaroo care, what is it? It is skin to skin and raising the level of oxytocin. So this bond that happens between such mothers, even if they are not breastfeeding, is really priceless, And yes, you talked about it being unfortunate. Some mothers are not able to breastfeed, various reasons. I feel, we as a society are failing these mothers if they are compelled to give formula to their babies because they did not get the right support, the right help at the right time. So naturally, they are like desperate. They feel they have no choice left, and therefore they are resorting to. So I don't blame them. I blame us as a society that failed to support these mothers.
No, you're absolutely right. And I think it's necessary for mom groups and women groups to be out there to support one another. I wish it could happen at a society level, but, it's not happened for a while. And I think women should have their support groups. I'm hoping, doctor, that you will connect us with resources as well. So in case any of our audience wants to reach out, that would be great. I want to go over a couple of misconceptions, where women think breastfeeding is going to be painful. Okay, that's one. Two is, because I keep talking about sleep. Okay, so a mother, when she delivers, she's like, Luke, what's going to happen to me now? I can't sleep. And I know I'll tell you, there was a doctor, she was 73 years old. I met her in New York. We were treating a patient together. Okay. And when I brought up this topic of sleep, I said, what about women who deliver? Because they have to wake up every 2 hours to feed. You know what she explained to me? I tried to get into the science, but everything made sense what she said. She said, Luke, when you have a normal delivery, there are certain hormones that are activated in a woman's body that allows for her to get up and go to sleep. And her cycle, her circadian rhythm will not create ill health problems, which is why if you ask a man to wake up like every 2 hours and stuff, physically, he will not be able to do it because he doesn't have the hormone activated. But in a breastfeeding mother and a mother who's possibly gone through a normal delivery, one of each, there are certain hormones activated that can allow melatonin to be more flexible in the wake cycle and the sleep cycle. And I thought that made absolute sense when it comes to nature. So I usually tell pregnant women that you don't have to worry. Get up as often. Your body's equipped. If you're tired during the day, take a break, sleep, take a nap. You know, you got to recharge yourself. But I would love your scientific and your medical approach on this, please.
So, see, what research on this, the night feeds and breastfeeding a baby through the night has found is that the mother who co-sleeps with her baby, their sleep cycles start getting attuned. So it is, and I'm sure the mothers in the audience who have breastfed their babies or who have just had new babies would have experienced this. Before the baby starts stirring, the baby goes into that phase of light sleep and starts moving a bit. Just a minute before that is when the mother is also awake. So the point is, this is like the beauty of nature, or you call it attunement or whatever it is. Our sleep cycles start getting synced. If the mother becomes an expert at breastfeeding in the lying down position, that would be the best, because her sleep is the least disturbed. She just has to turn, her baby has to turn toward her, they both nurse and they go back to sleep. And the dad, who may be in the same bed or same room, doesn't even realize when the two of them got up and went off to sleep. So it's just a process which is happening so seamlessly that also, yes, we were talking about hormones. The release of prolactin through the night again surges in a breastfeeding mother, and this gives her a sense of calmness. So although her sleep has been actually disturbed multiple times, when she wakes up, she has that fresh feeling like that she has had adequate sleep. So that is where the hormone comes into play. But if the baby is away from the mother, if it's, the mother has to actually physically get up and then pick up the baby, and then maybe the sleep is more disturbed, I feel. So we kind of recommend them, at least if they're not in the same bed, maybe have a crib which is attached to the bed so that the baby is just arm's length away.
I think so. You've actually simplified it, and it takes off so much complexity from what mothers go through. Dr. Manisha, thank you so much for your time. I'm going to do another session with you, because I'm sure there are going to be a lot of questions, and everyone in the audience, you can post your questions and Tina will have it shared with us. And once we upload the video, we will try to give you as many answers as we can. Of course, it's best that you talk to Dr. Manisha if you're going through a problem, because she's the expert who can help you through it. But Dr. Manisha, I look forward to a part 2 on this. Thank you so much for your time. I truly appreciate it. Everyone, thank you and have a great day.
My pleasure. Thank you so much.